Hi, my name is Florence Wood, and I'm from Prince Edward Island. I'm a registered nurse. I graduated from the PEI School of Nursing in 1977 and finished my degree, Bachelor of Science in Nursing at Dalhousie in 1997. Right from the time I graduated from nursing, I'd always look in the back of the nursing magazine, see where the jobs are, and there was always jobs for the north. And the job looked very appealing. You were out there on your own, and initially, for the longest time, I didn't think I had enough experience, and I needed, more training to go there. But then eventually, I started to get older. It's like time is running out, and I didn't want to have regrets about, I wish I had done that. So in 2002, I thought, this is the time to go north. So I took a leave of absence from my job in Halifax, and I was there probably about a month, and I thought, this is where my new career path's going, and I knew I wouldn't be going back. It was just a beautiful community. The scenery is beautiful, and I knew that this was going to be something I'd be doing. They assigned me to go to Pond Inlet, which I had no idea. I had to get a map out, and I told them that I wanted to be on the coast. Wherever they placed me, it had to be, not realizing that in Nunavut, every place is on the coast. There is only one inland community, but I just needed to be near the water, kind of thing. I didn't know anything about the community, but I got a map out and I Googled it and sort of did a little bit of research on the community, and I knew it was a 5-nurse station, so I thought, well, that's some security, that at least I'm not going to be out there on my own, and so I felt quite comfortable about going. And at that time there was a doctor in that community, so that was another reassurance that I had, but she stayed briefly and then she moved out of the community, but by then I had been well established. And the scope of practice was very different. I was used to working in teaching hospitals where the doctor wrote the orders and the nurse followed the orders, and you didn't deviate from that. I go north and we're working in an expanded scope of practice where there is no doctor in the community. You make a lot of the decisions on your own or in collaboration with the other nurses. We do a lot of talking back and forth with each other. Then you have such a greater sense of autonomy, and you use your previous experience and to make your own judgment calls. You get a great respect from the physicians that we talk to at the hospital in Cullowhit, because after you're there for a while, they know your capabilities and whatever, and you are given so much more freedom. They're still there as a resource if you need them, but the job is so rewarding in that you can make your own judgment calls. You can initiate the treatment, and you can see it through with consultation with the physician if necessary, but quite often just on your own. You can treat a pneumonia on your own. You don't have to call the doctor to get the antibiotic order, because we do have guidelines and we follow the FNIP guidelines very closely. And so it was a great experience. You did a lot of case management. You were the primary care provider for the individual, for the family, for the community. You knew all the members of his family, his or her family, so you knew what impact an illness was having on all the individuals in the family as well as the individuals in the community. If there was a lot of times we would try to manage palliative care patients in the community ourselves without If they went to the hospital, they would be alone, they would die alone. Maybe with one family member, they were allowed one escort only. So we tried to keep them in the community as much as possible. So you really had a sense of how that impacted on the family as well as the whole community. And where I lived in the community, I would go to the house and they would call me at home. So you were very much, the primary care provider for everyone. And you practiced primary care to the full extent that you could imagine that. So with the determinants of health, one of the issues that you'll see in the north is overcrowding in homes. That has a huge impact. You may have multi-generations living in one house, and you can see that a lot of people that really aren't highly educated, there's unemployment, there's all these things. Well, you look at overcrowding and that we have active TB, and how quickly, within several months, we went from nothing to 60, 70 cases of active TB. So things like that, housing, nutrition, there's a lot of poor diets, people eat a lot of junk food, that impacts on the prenatal care, that we have a high incidence of premature delivery because of poor nutrition, smoking, all these kinds of things. So it definitely impacts on the health of the community and the individuals. Well, the big one would be nurse practitioner. We don't have the authority to prescribe, but within the guidelines of FNIB, we can dispense medications following those guidelines. As well, we work in the expanded scope of practice where we diagnose more, and we do more procedures like suturing, putting on splint casts and things like that. We do x-rays. We're the lab of the community as well. Another one, I would say, forensic nursing. The north has a high rate of suicides, so anytime there is a suicide in the community, we have to obtain specimens for analysis, like for the RCMP, with their investigation. So you do some of that, not to a great extent. Nursing education, absolutely every day. It's just every patient that you're seeing, you're doing education somehow. We do radio shows in the evenings. We have a health fair every fall, which is well attended, and we pick, we might be doing blood pressures, and somebody else will have a presentation on STDs. We look at cholesterol and fat in the diet, so all those kinds of things. So a lot of teaching, and practice and policy. We're always looking at our policies that we have, and I was actually on the committee with updating some of the health policies for the health centers. So we pretty well do it all up there. And there's a few other things like OT, physio, those kinds of things which we do quite often. We have visiting OT and physio that come to the community, but they will set up a plan, and then we help with the follow-up. Or if somebody comes and has hip surgery in Ottawa, then they will stop and see the physiotherapist and evaluate, but then when they come back to the community, then we follow up. I think the highlight would be it's the job itself. It's an amazing job. It's, your experience is valued. You feel appreciated. The community respects you. I've never worked in a job where I got such respect from people, and you're just allowed to practice nursing the way it should be practiced, that we have this knowledge and we have these skills, and we should be allowed to use them. And instead of putting barriers up where you can only do that, or you can go this far. But in the north, you can certainly practice to the full extent of what you were trained for and educated for. I think there's many lowlights, and I think it's because you develop such a close relationship with community members, like you're part of the community, so you feel what they're feeling. And we had an avalanche where a little boy died, and I was on the scene when that happened. We had a tent fire where 4 people died. I was the first responder that went out there. So there's all those kinds of things, but all these families, and everybody, and as well, it's the staff at the health center. Like, this is their friends and their family members as well. So, everybody's hurting. So those were kind of the lowlights. Or we do have a high rate of suicide, and some young people that you would never expect out of the blue, and then all of a sudden they commit suicide, and you think, like, why did that happen? What did I not see? It's out of your hands, but it's still, you feel it like the community feels it. There's a lot. We do have, we're affiliated with CHIO in Ottawa, the Children's Hospital. So they would always do, every week they would do a telehealth on something for pediatrics. So that kept us up, because that was kind of not my comfort level in peds. I never worked in peds before, so. But we also, we always followed the guidelines, like, you follow the Canadian Pediatric Guidelines. You were always on their websites, or the new diabetic standards, or what are the new gynae standards. So you're kind of constantly updating. And I took many courses, online courses, attending seminars, that kind of thing. So it is, things change so quickly now with treatment. You have to keep up with it. And plus, you network with each other. Like, someone will say, well, I saw that new article on this, have you seen it? And then, we'll pass copies around or something. I think if it's something you're interested in, if you have a sense of adventure, if you want to work in this kind of environment, you want to challenge yourself, then absolutely go for it. I had the opportunity to live in one of the most beautiful places in the country that most people never ever get to see. I was welcomed into the community. I felt very valued there. Something that I've never felt in my nursing practice before. And it was a respect for the community as well, that, they felt that I was capable of doing the job. And, you don't want to retire and have regrets. That if you wish you had done it, then do it. It's a great experience, and one that you'll never ever regret doing. If you like the outdoors, you can drive for miles, go camping, skidooing, go fishing. There's a whole different world that I loved it when I was there. I think one thing is it's important to have a varied experience. Look for new opportunities. Just challenge yourself. Don't be in a rut. Live beyond your comfort level, sort of. So challenge yourself to, I'm comfortable in this now, but I'd like to try something else maybe. Well, try it and see. And the more experience you have, the more rounded you'll be. And if you do look at the north, then the greater chance that you will like it and not be intimidated.